Hello, and welcome to Island Health's instructional video on things you need to know when using the SARA 3000 floor lift. Always complete a point-of-care risk assessment prior to any patient handling care. This assessment may be displayed like this on any paperwork or care plan. And remember, prior to use of equipment, always perform a visual inspection of slings looking for any tearing, bleaching or holes. Do not use if damaged. The SARA 3000 and SARA Flex are useful for patients in need of moderate assistance that would typically require a two-person assist. And remember, for a patient to be appropriate to use a SARA lift, they must have cognition, balance and enough physical strength that are consistent with your unit's pre-standing check assessment. As part of your assessment, note that these lifts have a weight limit of 440 pounds or 200 kilograms. Now, let us look at the operation of these lifts. The lift is operating by a hand control or on the unit function buttons. They can raise or lower the lift bar or extend or retract the leg chassis. In the event of an electronic failure, the lift can be lowered with this emergency function. On the lift, you will notice that the battery has an LED charging indicator. Typically, the batteries will hold an 8-hour charge. On some models we have a weigh scale, simply push the blue button for a reading when the resident is weight-bearing on the foot platform. Now, let's discuss the sling. The most common sizes are red for small, yellow for medium and green for large. The color is indicated on the trim of the size and on the label. Now, let's observe a transfer highlighting some helpful tips. After choosing the appropriate size, place the sling around the person's back so that the bottom of the sling lies horizontally, and about 2 inches above the waistline as shown here. As you position the lift close to the person, have them put their feet on the foot platform and their shins against the pad shown here. The person can hold on to the black handles or, if they have limited shoulder range of motion, they can hold on to the end of the bar. Remember, the sling's support straps must always be securely attached before lifting, double-check to make sure. The lift can be moved from the rear or the side, depending on the space available and the situation. A helpful hint, it is much easier to turn the lift if one brake is locked. Finally, have the lift's brakes off while lowering the person. The manufacturer recommends lock to load, unlock to unload your patient. Thank you for watching. For more videos like this, check out our YouTube channel.